So if my Aunt Nina needs 5 units a week of Meals on Wheels and 8 units a week of home care and 3 units a week of adult day health care, she gets assessed for those needs. They're sent up to the commission aggregates everybody's needs, puts a dollar price on it for that package of services for everyone, and no one argues about it. And the reason that happens is because they believe and understand that they really are saving money in their nursing home budget. And so they have this unified system, and it takes out defending 800 different programs every year from the cuts, the death by 1,000 cuts that we've seen. So that's why we're explaining to policymakers what those elements are and how they fit together, because this is the payoff at the end of the day. There's a whole new way of budgeting for community services that's more like the nursing home budget, which is one line item. There's a bit of debate about that and the provider rates and what have you, but that's over very quickly. It's not like the ongoing, complete defense of every separate program. Thank you. Okay, so that's what the coalition is working on in terms of long-term care. And if there's another budget, another bill or more hearings, that's the work that we're going to be taking into the legislature, and we're also going to be talking to the new administration about. I'm looking around for a glass of water. So the other thing that we are looking at is understanding states that are more like us. So policymakers, I used to work at the Senate Office of Research for a long time, and I know that the first thing that legislators say is, well, we're not Washington State, we're California. Compare us to Texas, compare us to New York. I personally avoid comparisons with Texas. But this is how people sort of shoot down your arguments when you're trying to change the world, I have found. And so this wonderful person, thank you so much. I never ignore taking a look at states that look like us. And Pennsylvania is a state that when you talk to them, will say things like, well, we have a really strong county-based system, and we haven't done a lot, we haven't made a lot of progress with people with mental health disabilities because those mental health services are at the county level. And we work at the state level on long-term care, and they're sort of separate. And I think, wow, they could be describing California. And so, despite the fact that they have structural challenges or a framework that looks like ours, they have enormous success in this area of transitioning people out of nursing homes. In 3.5 years, they've transitioned 1,600 persons from nursing homes. Scaled from their population to ours, that would be 4,600 people per year. Go ahead.
No, I think it would be 4,600 persons in 3.5 years. They're a little over 1/3 our size.
I will take your correction. I got that statistic from Dr. Hendrickson, who wrote the really thick long-term care reform report, but I'll ask him to revisit it. But the California Community Transitions Program has transitioned about 173 people out in the 4 years since that program started. So what is it that they're doing to get these incredible results? Saving $200 million a year in their nursing home budget. And this statistic just blows me away. Roughly 1/3 of all transitions do not require state-funded services following transition. People are getting trapped in those nursing homes that have resources and strengths and resilience that they're not able to activate because they're kind of caught in these systems. But you give them a little bit of energy to transition out, and some of them go on and don't need any services. Okay. So we wanted to ask, how did they do it? They started with a money follows the person grant, that's how we do our work, and added general fund dollars, which we don't do. In 2008, they invested $10 million. In 2009, $14 million in general fund dollars. They used the general fund dollars to fill in the places where they need program flexibility. They have a reimbursement structure that fairly pays their providers of transition services. So they pay both for the time you spend with the person and the time that the person is living in the community. And so the providers are providing supports all of that time at 30, 90, 180, 270, and 365 days they get paid. The most important thing I think is about housing, and this is about leadership. The governor of Pennsylvania knocked heads, and he said to his cabinet level leaders, work together. I want long-term care and I want housing to work together. And so they came up with a whole plan. I wrote a small report on this that was supposed to be in your binders, and I'm not seeing it. So you can look for it on a website if you're really interested in housing. This is a really good model to look at because they're using the existing resources that they have in their state to better coordinate with people that are transitioning out of nursing homes. They have preferences in their HUD vouchers for people that are transitioning. They have rental assistance and they have rental training programs. I have one observation about state and county roles, and that is that civil rights have always been most effectively advanced from federal and, shall we say, in the state levels than at the local government level, and that many of our citizens would still not have the right to vote if we had depended on Alabama and Mississippi to implement their voting rights. And it's important when you work statewide, and maybe you work a lot in a county that's pretty progressive, to think about Imperial County, think about Modoc County, and understand that we need advancements for everyone in our state. So sometimes those state policies really help. So that covers the first two areas of the 5 that I was going to talk about. Long-term care reform and targeted initiatives. The third one is an area in which I'm not expert, but luckily you have already in your binders my source document, which is the SCAN Foundation's policy brief. The SCAN Foundation has done us all a great service by looking at these federal health care reform measures and understanding which parts of them relate to long-term care. And I see that you have that, so I will just sort of briefly go over this. Lisa Sugarman is the person who wrote that policy brief. So what they're doing is taking a look at how, in addition to an expansion of health insurance, long-term care is going to be advanced under federal health care reform, and how we need to sort of get in and pay attention to those new regulations and make sure that they are aligned with our goals. One of the important aspects, most important probably, is the Class Act, which will provide long-term care insurance with no exclusion for pre-existing conditions after a 5-year vesting period, and provide a $50 per day cash benefit to purchase services and supports for personal care. The Community First Choice Act increases the federal share of community-based attendance services. The Home and Community-Based Services State Plan option increases federal reimbursement. Yes? I'll repeat her question afterwards if you can't hear it.
A 5-year vesting period, that means that you put money into the program for 5 years, then
yes.
you get it?
This is about how to change the system. So her question is about the 5-year vesting period, and so, I'm sorry, I'm making it hard for the videographer. I'm coming back. I'm non-compliant. Yes, so that is about long-term system change, so that people who are working now will purchase this long-term care insurance through their employers. It's done in a way that you have to opt out. You're automatically opted in, and then if you want to opt out, you can opt out. And so they anticipate many more people will participate, and after 5 years will get vested, and so in the future, many long-term care services in our country will be financed this way. But it's not gonna affect anybody now. You have to be vested for 5 years. The Home and Community-Based Services State Plan option increases the federal share of cost for community-based services, so basically the federal government pays more. There are expansions and extensions of Money Follows the Person demonstration projects. So our program that has transitioned 173 people has a longer period of time to get on its feet, more funding, extends spousal impoverishment protections, funds aging and disability resource centers. There's a care transitions program, and support for the direct care workforce. So, you know, these workforce issues are always thorny and they take a long time to bear fruit, but we all know that there aren't always enough caregivers, there aren't enough from personal care to medical care, there are not enough providers, especially in rural California. So this funds some of that. So I think the message about federal healthcare reform is stay tuned and be empowered. It seems like it's a long ways away, but there are groups like CFILC that are sponsoring teleconferences with people working in Washington to make sure our interests are represented as the regulations get written. And there are ways to impact how that's actually implemented that will make a difference. This piece is just really fun. Because I think we've all been waiting for so long for Olmstead to be real. And now we have an administration that's taking it seriously. And I had the honor yesterday of participating in a teleconference, a White House-sponsored teleconference, which impressed me, from my home office in Tahoe Park, California, where basically the Department of Justice went over the Georgia settlement. How many people heard this week about the Georgia settlement? So a couple of people, I'll mention, sorry for the redundancy, the Department of Justice has filed a number of amicus briefs in many states, including in California and Sacramento, around the mental health system. They've joined the IHSS suit that Disability Rights California did. But they have strategically gotten involved in Olmstead cases all over this country. And the ruling this week, the settlement that they reached with Georgia, it's significant because Georgia was the state that tested the Olmstead question in the first place, right? And so they've basically reached an agreement to transition thousands of people with developmental disabilities and mental health disabilities out of their state hospitals. They are not putting anybody into their developmental centers anymore. They are creating waivers for community services. And unique among the mental health system is they're creating an array of services that the person really needs, like crisis services will be part of the array of services that people will receive in the community.